Today, if we want to know what is happening inside the human body, we rely entirely on machines. We put people into massive magnetic tubes to slice their biology into digital pixels. But rewind 3,000 years. No microscopes, no X-rays, no anatomical scanners. How could someone in the ancient world accurately map the unseen systems hidden beneath our skin? The answer is recorded in the Atharvaveda. Inside its verses are precise bone counts and a specific month-by-month timeline of human embryonic development. This text documents the mechanics of the human body, providing an early record of what the sages called Sharir Vigyan. This visualization shows the text's categorization of the human skeleton. The Atharvaveda counts exactly 360 individual bones. Modern textbooks put that number at 206. The difference comes down to their classification system. Vedic anatomists included teeth, cartilage, and small joint fragments in their total. They paid special attention to the joints, or parv, noting which connections were vulnerable to injury. That mapping later provided the structural data for the Sushruta Samhita, the world's first surgical textbook. Moving from the structural to the mechanical, the Atharvaveda positions the heart as the central engine of the body. It describes 101 nadis, a massive interconnected network of veins, arteries, and nerve channels branching outward from the chest. In Western medicine, the English physician William Harvey is credited with mapping blood circulation in 1628. Yet a detailed heart-centered biological network was already recorded in Sanskrit millennia prior. The Vedic sages understood that the human form is a pressurized, constantly flowing biological engine. The Atharvaveda identifies Panch Prana, 5 vital forces managing specific functional zones. Prana manages oxygen in the lungs. Samana handles stomach digestion. Udana controls the throat and brain. They categorized the body into functional equivalents of the respiratory, digestive, and nervous systems. This understanding of functional zones led to the mapping of Marma Sthan. This is a precise grid of 107 critical pressure points across muscles, veins, and bones, where physical trauma causes catastrophic system failure. When you look at the dense network of nodes documented in ancient Chinese acupuncture, the structural overlap with the Vedic Marma points is immediately clear. This anatomical map is applied today. These 107 Marma point coordinates dictate the strikes, blocks, and physical leverage used in Kalari Payattu, India's oldest martial art. This ancient anatomy had immediate, practical applications. The same coordinates used to heal the body from within were used to dismantle an opponent in combat. To truly test their observational limits, we have to zoom down to the microscopic level and look at Garbha Vigyan, the Vedic science of embryology. This visual illustrates the text's month-by-month documentation of a baby in the womb. In the first month, the embryo is a fluid droplet. By month 2, it condenses into a solid mass. In the third month, limbs begin to sprout. By the fourth month, bones and skin form. The sixth month brings the first signs of movement in the womb, and by month 7, the fetus is described as being fully conscious and reactive. Compare that ancient 7-month progression with modern clinical embryology, and the milestones line up almost perfectly. Tracking fetal development through the uterine wall without ultrasound technology required years of disciplined observation. When you pull back and assemble these 360 bones, the 101 arterial pathways, the 5 metabolic zones, and the 107 pressure points, they form a cohesive map of human biology. Thousands of years before the invention of the microscope or the X-ray, the scholars of the Atharvaveda had compiled a comprehensive medical and embryological record. We often draw a hard line between ancient spiritual texts and medical science, but looking at this data, that dividing line is an illusion created by modern biases. To help us decode more of this heritage, hit the like button and subscribe. Let us know in the comments which ancient text you want us to investigate next. The ancient sages who compiled these texts were pioneering scientists. Through systematic observation, they mapped the vast, complex universe hiding right inside of us.